So welcome to your next chapter. My name is Siobhan Cefarelli, and I'm here today with Katrina, who's awesome. I'm not going to even attempt the last name. I will let you do that. So she is here with All of Us research project. I had the great pleasure of meeting with her coworkers at the latest West Hartford Senior Center event, which was awesome. And I was absolutely fascinated. I have tons of questions. So let's get started. Tell us about All of Us research program.
Yeah, so hi, my name is Katrina Yamazaki, and I'm the principal investigator for the All of Us research program. And so the All of Us research program is an NIH initiative to advance precision medicine. And so this whole program started from President Obama's precision medicine initiative that really tried to understand how to shift healthcare from a one-size-fits-all model to more of a tailored approach to healthcare, right? So for example, if you're looking at your neighbor, you understand that there are differences between you and your neighbor, and your healthcare should reflect those differences, right? So you want healthcare tailored to you in order to put you in the best possible outlook, right? Or put you on the best possible track for treatment.
Definitely.
And so the All of Us program is really designed to diversify research. And so historically, a lot of populations have been left out of research for various reasons. And so we don't have a true understanding of different factors that impact their health. And so if we shift to precision medicine, we really need to understand those differences. And so All of Us is building this database for healthcare researchers to really begin to understand different factors that affect the health of different populations in order to design more targeted therapies, treatment plans, things like that. And so All of Us, the goal is to enroll 1 million participants.
Wow.
That reflect the diversity of the United States population.
Wow. Now, where are you guys with that goal?
So we are currently, so the national program is, we have roughly over 650,000 participants that have already enrolled and started the process. Out of that 650,000, about another 450,000 has completed all the steps for enrollment. And that means they've submitted surveys to answer questions about themselves, their personal health, their lifestyle. They've also submitted biospecimen samples such as urine samples and blood samples so that their DNA can be sequenced to understand genetic components of that affect their health. And so we consider those core enrollments. And so we're roughly at 450, just a little under 500,000. And so the goal for the rest of this year is really try to get over that 500,000 mark. And what's remarkable is through all of the enrollment sites across the United States is the population is 80% UBR, which stands for 80% of the participants are from populations that have been historically underrepresented in biomedical research.
Nice. So why would I participate? Besides the fact that it's really cool and I'm fascinated by this stuff, but why would I participate? Why would I do this?
So a lot of the reasons why participants join the program is one, the All of Us research program is unique in that they value participants as partners. And so as we gather all of this information, one of the main goals is to return results to the participants so they can see how their data is being used to accelerate precision medicine research. And so we send out research highlights to show how your research is being used for different research studies. For the individuals, they get ancestry data as well as health-related results data. Those health-related results data is important because through DNA sequencing, you get genetic tests done and then if basically your DNA is sequenced and then genetic tests are done to see if you are at risk for different diseases such as cancers or cardiovascular diseases. And if you have a positive screen for those, then we set you up with a genetic counselor
Wow.
for free, so you can actually discuss those results and decide the proper course of action, and help coordinate care with your primary care provider.
That's fantastic. I think especially it sounds like it would be good for someone that is adopted, for example. And let's say we don't have a lot of documentation on the adoptive parents, and now you're having your own kids and you're standing there going, do you have this in your background? And you're like, yeah, I don't know. This would be a great opportunity to find that out.
Yeah, I love that you brought that up, because I myself in it, as it, I, me and my husband adopted 3 kids from the
Whoa.
foster care system in San Diego, and not having their full medical history makes
Yeah.
it hard to understand their developmental milestones growing up. So they're all under the age of 4. And so
Wow.
I am eagerly awaiting for the pediatrics program to unveil, so that we can enroll them in the program and start to receive some of those information that we are missing in order to, provide the best care that we could for our children.
That's awesome. Now, how much does it cost?
It actually doesn't cost anything to participate. So it is completely free of charge.
Yep.
And so enrollment is coming into an enrollment site or completing the steps on your own. There is no charge to join. There is no charge for the return of genetic results. And there is no charge if you need to see a genetic counselor based on your DNA results.
Nice. And actually lead me, if you can go more in depth. So the next question is, how do I participate? Because you said enrollment sites or online, what's the website and how do I do that?
So the website is on my Zoom background right there or right there. And so that's a great place to find out more information about the program.
Nice.
And on that website, there is a registration button where if you are able to start the process on your own, then you can just go ahead and start creating your account in the participant portal and start filling out surveys and going through the consent materials.
Nice.
For anyone that needs help with that process, because it is a long process, and would just want, a person to guide you through the enrollment.
Of course.
We have our research team is at Community Health Center's location. We are fixed permanently in Meriden, New Britain, New London, and Middletown, but we've also started going out on the road and visiting other community health center locations throughout Connecticut, to help facilitate the enrollment process and raise awareness of the program. But at any time, you can also call our main line or email us, and we can easily contact you via phone and help you start that process. And so our email is allofus@chc1.com, and our phone number is 860-852-0890. And one of our team members is more than happy to walk you through that process.
That's awesome. And you can send that to me and I'll include that in the description of this show so they can
Perfect.
find it. Yeah.
That sounds great.
How long does it take for me to get results? Because obviously, people are probably like, wanting to get it as quick as possible.
Yeah, it does take time to get the results.
400,000 people. So I'm thinking it's going to take a minute, right?
Plus, more people are enrolling each day, so it does take time to get the results back. Ancestry data tends to come a little bit faster than the health-related results information. We've seen the results take a short amount of time to a long amount of time, so we really don't like to give an approximate timeline because we don't want to really get anybody's hope up, but we are working with the national program to make sure that all participants get a return of results, and working with them to see if there's any errors that we may help fix to make sure that the participants get return of results.
Very nice. And so the website's there, so that website they can go on and let's say, because this is obviously going to be out there nationally, they can go wherever and find out, if they're in Oklahoma, they'd be able to go on this same website and find information.
Right. So this website is specific for our community health center with the /CHC.
Got it.
But joinallofus.org is the national website that anybody can go on and join, and read about more information or learn about programs in their home state or in their hometown where they can go and enroll in the program.
Wonderful. Now you said ancestry information. Tell me more about that. So am I going to find like a long lost aunt or uncle or?
No, so it's nothing like genetic like some of the genetic kits out there. So it's not like 23andMe or where they start to connect the people across the
Yes,
US,
which
like
could be
you have
scary.
a sibling in this state, right? It's nothing like that. What
Okay.
it does is it will just tell you where your roots lie from. So if you don't know, like let's say you were adopted and you don't know what your ancestral data is, it'll just return information that, oh, your ancestry is from this part of the world and this
So
part of the
important.
world. You're
Yeah.
this percentage of this,
Yep.
these
That's very
different
important.
national.
Yeah.
Mhm.
So in terms of privacy, obviously, we're in the age of like, we're all out there, but with our medical information, HIPAA and those types
Right.
of things, how is that participant protected?
Right. So privacy and security is one of the core values of the program and is something that we take very seriously. And so there are precautions that are set up to minimize the risk of participation or of security breaches. We can't guarantee that there will be absolutely none, but we do take all the precautions to minimize everything. And so we like to tell our participants that any information that they submit, as soon as it goes into the portal, it becomes what we call de-identified, meaning that all of their survey responses are inputted, but all of their identifying information, name, phone number, addresses, are removed from the system and they're assigned a unique participant ID so that we can use that participant ID to connect to survey questions, electronic health record information that's in there, biospecimen information, but you can't actually connect it to a particular individual. The program also has certificates of confidentiality, which they have implemented to prevent the sharing of data with any court orders or things like that, so that things remain as secure and private as possible. And so we don't share your genetic results information with anyone, even if you have the like you have to go see a genetic counselor. They'll walk you through how to then, and they'll provide a clinical test to verify, but how to download that report, and then the individual themselves have to take it to their primary care provider. So we don't share it between the families.
I like that. And I like that it's a part of your core values. I think that's going to make people feel super comfortable. And it seems extremely well thought out, which is great as well. Because sometimes with stuff, yeah.
Yeah. Well, it's extremely important because historically, with some of the research that has been going on, we're trying to rebuild trust within some of these populations. And so that's why it's one of the core values, is really trying to make sure that we are being transparent with what we're doing to try to build trust within the communities, because it's so important that they participate in research. And so really just trying to get them more comfortable in participation as well.
Yeah, let's talk about more about that underserved population. Who are they and what do you mean?
Mm-hmm. So those historically underrepresented in biomedical research populations include ages 65 and over, right? They tend to be left out of research. Racial, ethnic, marginalized populations have tended to be left out of research. Members of the LGBTQ community, right? We also have those that fall under the federal poverty level. And a lot of these reasons why they've been left out of research is maybe access to research opportunities, not being aware that they exist. And so really trying to make sure that this program is accessible to all, and that we really promote the message that we value participation from all.
And it's I think the trust. I mean, I know that, when you're, having been someone that has been in that, lower income level, I mean, it's kind of like it's kind of like you want to protect everything. You don't want to be given more information, and there's a lot of disappointment too, where someone doesn't do what they say they're going to do. And so it's like something like this, you would be like, huh, what's going on there? But it sounds amazing. And it definitely sounds like something that's going to help a ton of people. I love that my doctor right now, I'm not a one size fits all. My entire life, it was like, you need to gain weight, you need to gain weight. And now she looks at my weight and go, I haven't heard that in months from her, because I'm working,
Right.
I'm doing what I have to do. She's looking at my numbers and she's not comparing me to a, 57-year-old woman that, she's going, And so it's nicer not to hear you have to gain weight, because like any of us, we all have trouble with our, something that weight,
Mhm.
who knows what it may be, and either up
Right.
or down. It's not like you're not trying. It's like, but it's so to hear it and go, well, what should I do? But she's not
Mhm.
one size fits all. So it sounds like this is going to even more, get rid of that one size fits all, so we can, especially with that whole positive body image thing and all that going on, that is so important, because nobody wants to go to the doctor. Some of us are, bigger boned. We're
Mhm.
not going to be, looking like whoever, and so to compare me
Absolutely.
to them or them to me, it's not fair, because you can't do one size fits all. So I love that. I love this type of research, and I love what you're doing.
Yeah, I think it's important, right? Because even if you think about beyond an individual, it could be a neighborhood, right? You can be telling somebody that's in a neighborhood with maybe they're pre-diabetic, and you're trying to prevent them from, moving into that diabetic range. A lot of the information: eat healthier, move more, right? If the individual lives in a community where there's no safe spaces to exercise, right? Or access to healthy foods, it makes it difficult. So,
Yeah.
what are other ways that we can help them manage their chronic diseases that match the environment and the lifestyle that they live? Because it could be sometimes it's out of their control,
Yeah.
right? So, really trying to figure out, what are some of the best intervention strategies to implement in different communities.
Yeah, I like that. And I think that builds trust too, because you see me. You're not just
Exactly.
kind of throwing out buzzwords. You can see,
Mm-hmm.
okay, yeah, that sounds great. That's the, pre-diabetic solution, but I live XYZ, and you guys will have those customized plans, and that's going to build trust too, because you're not just
Mm-hmm.
throwing out stuff. Yeah. Tell me about some of the organizations, and you might have mentioned it in the beginning, so I apologize that this whole thing is affiliated with, because it's
Mm-hmm.
join all of us is kind of which I love. And it's funny, I'm looking at your backdrop now, which is just, I think it clicked like maybe 5 minutes. Oh, be one in a million. They want a million. Brilliant, by the way, but being in person. So, but what is the organization, the higher kind of organization that all of this is affiliated with?
Right. And so, like I said, this program is funded by the NIH. And so, within the NIH, we have different, what we call regional medical centers. So, these large academic institutions that are enrollment sites. And so, if you're in California, the UC systems, right? But in Connecticut, there's Yale. So, all of these different areas are enrollment sites. So, we have enrollment sites all over the US, or at least if they're not in your state, the option for online enrollment. Um, and so there we have numerous participations, and the map is on the website joinallofus.org.
Nice.
Community Health Center is a federally qualified health center. And so we're joined by 7 others that are under the MITRE Corporation that help us with our enrollment sites. And I know that there are other federally qualified health centers that partner with the regional medical centers or the academic institutions as well, to really facilitate the enrollment process.
Nice. Tell me about your background, because you know a lot. There's a lot going on there.
So I'm also, so besides being a PI with the All of Us research program at the Community Health Center, I'm also a senior research scientist with the Weizmann Institute, which is the research, education, and policy arm of the Community Health Center. And a lot of the work that we do is trying to innovate healthcare systems, access to care, interventions through research, education, and then trying to influence health policy as well. And so I've been here for about a year, but a large part of my career has been spent in the academic institution, where I was a professor within the biology department at California State University, LA.
Wow. That's awesome. Wow. That's phenomenal. I know my daughter is very interested in the whole genetics world, so I'll have to maybe have her shadow you one day or something like that. She would be fascinated.
Absolutely.
She's fascinated by it. Every time I say something, she's like, well, no, they wouldn't be a blonde baby because of, and I'm just like, but she loves it. She loves it, the whole thing. So that's great. Well, one more time, tell us how we can get in touch with your organization and, yeah.
Right. So again, we run out of the Community Health Center
right there.
in
Right there.
in Connecticut. This is our website that you can join to learn more about the program, and it actually connects you to our All of Us program at Community Health Center.
Nice.
Our email again is allofus@chc1.com, and we monitor that frequently, regularly, so that we will make sure to respond to you. And we also monitor our phone lines, 860-852-0890. So please give us a call, send us an email, or look at our website, and we'd love to help you become a participant in the All of Us research program.
That is awesome. So again, I'm Siobhan Cefarelli, senior research. I want to be like you. Senior living specialist here at the Heights at Avery Heights. You probably hear tons of noise in the background. That is our amazing renovations that are going on. So we're renovating our whole lobby and everything. So we welcome folks to come on in and check us out. We're excited about that. And until next time, we're definitely going to have you come back in when you get closer.
Would love to.
Yeah, very interesting stuff. And I want you to send me some materials too, so I can pass them out to my the gang here, because we definitely have a lot of over 65 here. So we can maybe build that number for you for sure.
Perfect. And we would also love to come in person and talk more about them in person.
I
if
would love
people have
that.
questions.
Yeah, that would be wonderful. All right. Well, thank you so much. I appreciate it. All
No
right.
problem. Have a wonderful day.
You too.